Hi, I'm Dr. Gary Kaplan, Medical Director at the Kaplan Center for Integrative Medicine in McLean, Virginia. I'm also a clinical associate professor at Georgetown University. COVID has been a devastating disease over the last year and a half. We've seen over 64 million people in the United States alone suffer with COVID-19. Of greater concern is that we've lost over 700,000 people as a result of this disease. But the disease isn't done with us. The evidence is demonstrating that somewhere between 5% to 30% of people who've developed COVID-19 go on to have a chronic disease. These chronic diseases are ongoing symptoms of the original presentation of COVID-19, but are not unique to COVID-19. They look a great deal like the problems we see with chronic fatigue syndrome. They look a great deal like the problems we see with chronic pain syndromes. We see people with chronic headaches. We see people with sleep disturbances. We see people with neuropsychiatric problems such as anxiety disorder and depression. We see people who have gastrointestinal problems with bloating, gas, diarrhea, irritable bowel syndrome that they did not have prior to getting this disease. So we now have this whole group of people who have what we now refer to as post-COVID syndrome. Post-COVID syndrome doesn't seem to matter as to whether or not you had a mild or a severe case of the disease. It also doesn't matter as to how old you were when you got the disease. So we're seeing it across the spectrum from the young to the elderly, and we're seeing it with people who have a very mild disease and people who had very severe disease. They present with all kinds of different symptoms, but symptoms that we have seen in lots of different other cases that have previously been diagnosed as chronic fatigue syndrome, fibromyalgia, chronic daily headaches, gastrointestinal problems such as irritable bowel syndrome. So we have methods of being able to treat these conditions. More exciting and more interesting is that we have specific ways to be able to identify COVID patients, post-COVID patients, and specific treatments that we can tailor to treating them. This is brand new. It's only been available to the medical profession within the last 6 months, and it's getting increasing clarity in terms of how we can specifically tailor treatments to address your concerns. At the Kaplan Center for over 3 decades, we've been treating people with complex chronic illness. We're very excited about the potential of what we can do in terms of helping people recover from post-COVID syndrome, and we're here to help you. So we want you to know that there is help available. We want you to know that there is an opportunity for you to completely recover your life, and we are here to help.